What do you think is the most powerful tool in a doctor's office? You might think it's some fancy machine, like an MRI or a complex blood test, but it's not. The most powerful tool? It's just a conversation. And what we're going to explore today is how that conversation is basically medicine's greatest detective story. And the best part? You're the star witness.
Just look at this number, 80%. I mean, let that sink in for a second. That's how many diagnoses can be made from the patient's story alone. We're talking 8 out of 10 times. A good doctor can pretty much figure out what's going on just by listening to you, before they even lay a hand on you, before a single test is run. It's not magic. It's just the incredible power of what's called the clinical history. And this quote, it just hits the nail on the head. While a laboratory result is data, a history is knowledge. Think about it. A lab result, say a blood sugar of 150, that's just a number. It's raw data. But a history? That's knowing that the person with that number is also incredibly thirsty, tired all the time, and, oh yeah, has a family history of diabetes. See? That's not just data anymore, that's knowledge. It's the story that gives the numbers meaning. And that's where the real answers are found. Okay, so if we're treating this like a detective story, then every good detective needs a blueprint, right? A reliable framework so they don't miss any crucial clues. Well, in medicine, that's exactly what the clinical history is. It's the doctor's investigative blueprint.
And this is it. This is basically the standard issue case file for our medical detective. It's a really systematic process, as you can see. They start with the basics, patient particulars, and then they get right to the point, the chief complaint. But from there, it gets so much deeper. They dig into the whole story of the illness, your past medical stuff, any drugs or allergies, even your family and social history. Every single piece is a potential clue that gets carefully filed away. All right, so we've got the structure, the blueprint, but that's just the beginning. The real magic, the art of it all, is in the interpretation. This is where the doctor has to put on a different hat. They become a code breaker, really, translating your everyday words into critical diagnostic clues. Take the word dizzy. It seems so simple, right? But look at this. A patient walks in and says, "I'm dizzy." Well, what does that actually mean? If you say, "The room is spinning," the doctor immediately starts thinking about your inner ear, vertigo. But if you say, "I feel like I'm going to pass out," boom, their focus shifts entirely to your heart. And if you say, "I'm just unsteady on my feet," now they're thinking about your brain. See that? One simple word can launch 3 totally different investigations. It's wild. And the words you choose, man, they can change the entire game in a split second. Let's say you have some chest discomfort. If you call it heartburn, your doctor's going to start thinking about your stomach, right? Makes sense. But if you describe that same feeling as a crushing pain, everything changes. Suddenly, you're in a completely different universe, and the top priority is your heart. Your choice of words is literally a critical clue. So how do they get all these crucial details? Well, good investigators have a toolkit. This one, Socrates, is a classic. It's a framework for basically interviewing the symptom itself. Where is it? When did it start? What does it feel like? Does it move around? What makes it better or worse? This isn't just a random list of questions. It's a super smart way to build a complete profile of the culprit, getting its story from every possible angle. And sometimes the culprit is hiding in plain sight. There's this thing called an iatrogenic cause. It's a fancy term for when a medical treatment is actually causing a new problem. This is exactly why that drug history part of the investigation is so important. For example, someone comes in with this nagging cough that just won't go away. A doctor could waste a ton of time and money looking for a lung infection. Or they could look at the drug history, see the patient just started a new blood pressure pill, an ACE inhibitor, and realize, aha, that's it. The pill is causing the cough. It's a side effect. Case closed, just like that. So having the blueprint and the tools is great. It's essential. But the best detectives, they have something more. They have a certain mindset. It goes way beyond just checking boxes on a form. It's the art of really listening, of connecting clues that might seem totally unrelated, and weaving them all into one coherent story. The whole visit, from start to finish, has this flow, this life cycle. The investigation actually starts before you even set foot in the office, with a doctor reviewing your old case files. Then it's all about building rapport, making you feel comfortable enough to talk. Then comes the main event, gathering all the information. After that is the really crucial part, synthesis. That's when the doctor's brain is working overtime, connecting all the dots. And finally, there's closure, where they circle back with you, confirm they got the story right, and you both agree on a plan.
It's a real journey. One of the coolest interrogation methods they use is called the cone technique. So, part one, they start super broad, an open-ended question like, so, tell me about your pain. The goal here is just to let you talk, to let you, the witness, tell the story your way without any interruptions. They want that raw, unfiltered narrative. Okay, so once they've heard your whole story, then comes part two. The detective starts to narrow the cone. Now they come in with those very specific, closed questions. Is the pain sharp, or is it more of a dull ache? Does it seem to move anywhere? This is all about clarifying those super important details and really zeroing in on the clues you've already given them.
Now, every once in a while, a patient gives a clue that's so unique, it's like a criminal leaving a perfect fingerprint at the crime scene. They call these diagnostic fingerprints. These are symptoms so specific, so telling, that they pretty much solve the case right then and there. A classic example, a patient describing a thunderclap headache, a headache that's just bam, sudden, severe, out of nowhere. That is the unmistakable fingerprint of a very specific, very serious type of brain bleed.
So, we've looked at the structure, the tools, the mindset, but what does it all boil down to? One simple truth, really. The entire investigation hinges on you. You're not just sitting there while things happen to you. No way. You are the detective's single most important partner in solving the mystery. And why does this matter so much? Because your role as the star witness is, well, it's everything. Being really clear about what dizzy feels like to you, giving all those little details about your symptoms, being totally honest about your history, all of that is the high-quality evidence the detective needs. The better your story, the better the clues, and the faster they can crack the case. So the big takeaway here is this. Every little detail matters. Every single word you use could be a clue. Your story is, without a doubt, the most powerful tool in all of medicine. And that just leaves us with one final thought to ponder. In your own health story, what's the one clue that matters most?